जैसे मैंने कहा is the two things in this model we have developed that was not there earlier. पहला है जो ये degeneration model, because ये degeneration model we've not seen anywhere before. So putting the input parameters, we can tell you okay what is the duration in which you can lose your hair completely, right? That is individual for every patient. That's the first part. The second part, जो machines के द्वारा नहीं could not happen earlier, is cross-referencing the entire 1.5 million data that we have to tell the doctor which is the best treatment for the patient sitting in front of him. If you do this test, and if I do this test, and if he does this test, the treatment recommendation will come different because it will be personalized for you, personalized for me, and personalized for him. So that is something that earlier was doctor dependent, because the doctor had to, look at the patient, apply his mind, and say, okay, मैंने ऐसे 1000 patients देखे हैं, therefore I think this is the right protocol of treatment that will work. Or the doctor had to sit in the computer and start pulling out cases and start spending time to study those cases. That entire time of the doctor can now be used for doctor-patient interaction. That's the benefit.
The Hollywood stars, they're going in for a kind of analysis. Like they don't have cancer, breast cancer, and they're going for their genetic so now with this, if somebody who's got normal hair, it seems to be normal, can he or she go in for a test? And can we have a demo for a person who's got as seemingly normal hair? What's the analysis, what the AI is giving to us?
So two things here. What the AI can give you today is based on symptoms, not based on genes, right? We are trying to develop something with the hair loss gene as well to see how that can progress. But it can give you an answer based on your symptoms, based on your type of hair condition, how the progression rate will be. And definitely based on that, you can take treatment to prevent it.
Thank you.
So AI का तो कोई side effect होता नहीं है, because you're not really penetrating the patient. In all the treatments that we give at Dr. BATRAS, we make sure that they are safe, because as homeopathy, the core promise is safety. All our treatments, none of them are invasive. So हमारे clinics में we don't do anything with a syringe or a needle. We don't do anything. We don't do any Botox or fillers. We don't do any hair transplants. So all our treatments are 100% safe without any side effects. Yes.
Good morning, sir. First thing is that ChatGPT. If I talk about AI का अपना algorithm होता है, जिसके अंदर वो मिलियन ऑफ डेटा जैसा आप बता रहे हैं वो फिट करता है. उसके बाद वहाँ से आप चीज़ों का इनपुट और आउटपुट निकालते हैं, राइट? बट कई बार ऐसे भी केसेस आ जाते हैं इन दी मेडिकल साइंसेज, एज आई हैव रिटन एंड रोट सम रिसर्च पेपर ऑन AI. So what I have observed that sometimes even AI also not respond. So what will be the next step? What will be the next step?
Very good question. AI depends on input.
Yeah.
And AI depends on big data.
And also you said that the data won't be leaked. But if I studied that the cloud computing and all, उधर पे तो कहीं पे हमारा डेटा सेफ ही नहीं रहता. If we talk about if we are based on internet services, जैसे ही हम फाइबर से कनेक्ट होते हैं, no data will be safe.
So you're right. There is no safety in banking, technically, because even your bank account can get hacked. The minute you've seen Jamtala and all how they take your OTP. So safety depends. I mean, this is the most safe model that we could build, right? Because it's an internal model, we're not dependent on anybody external to store the data. That's the point, right? Can it be hacked? Potentially, yes. There is a 0.01% chance that it can be hacked, but of course all the firewalls, all the safety networks, everything has been built in to see that that doesn't happen, right? In our clinics, there is no data kept on a computer, because nobody can come physically and even hack that data. So we've done everything possible, to the best of our ability to see that that doesn't happen. However, there is always that 0.